Hi, I'm Amy Marsalis. Picture this. You're a 36-year-old woman balancing a demanding career, being a wife and mother to a young daughter, when all of a sudden you're rushed to the hospital to open a blocked artery. This is what happened to Susan Martin. Susan is here to describe, what she remembers about that entire experience. I imagine it's kind of a blur, but certainly you must have had some symptoms leading up to that time. Do you remember?
Absolutely. I was pretty exhausted and tired, and had really a severe shoulder pain. And I brushed it to the side as maybe a pulled muscle from wagging a laptop bag around, and just was so busy, didn't heed the symptoms like I should have.
Under a lot of stress with all you were trying to juggle, so you thought it was just normal what was happening to you.
The working mom stress and the tiredness, I just attributed it to what every mom feels. So
when you got to the hospital and after they did the procedure to open the blocked artery, what did they tell you you needed to do next to get better and to take better care of your heart? What was the diagnosis really then?
Well, there was a couple of things. I was diagnosed with Addison's disease, which is an autoimmune disorder, and that probably, along with the heart issues, contributed to me feeling tired and weak, and just really not being able to do the things I'd been accustomed to before. And what I needed to do was get strong again and have some of my hormones regulated, because the Addison's gets you off kilter in that area, and strengthen my heart. So right now I'm in cardiac rehab 3 days a week, and I can really tell the difference in my endurance.
Susan, you benefited directly from the Chest Pain Network. Tell us about your experience.
The paramedics took me to Williamson County Medical Center, and Dr. Franklin put in a stent to help with the blockage that I had. And then I was sent to Baptist Hospital, and where probably 100 tests were run to see why this 36-year-old had a heart attack. I was under the care of Dr. Stacy Davis and Renee Lassinger, and really just had a great experience at Baptist. The nurses pampered my family. I mean, I was there for 31 days. So
because, as you said, 36 years old going through this, and again, a picture of health. A young woman in the prime of life does not expect this to happen to her. You had to be so scared, so you needed that kind of warm support around you.
Absolutely. They were great to my family. My parents and my husband practically lived there. So we got very familiar with the Baptist Hospital staff, and everything went well. That's where they were able to diagnose me with the blood clotting disorder and Addison's disease.
And as part of your rehab now, what are you doing?
Yeah, I go 3 times a week to Williamson County Medical Center for cardiac rehab, and we do quite a bit of work on the treadmill and a recumbent bike, as well as lifting weights, which I really needed to build up my endurance again, and I'm feeling that starting to come back and feeling like my old self again.
Maybe even better than your old self?
Yeah, that's my goal. I definitely want to take better care of myself, listen to my body, just really eat well, and try to work out several days a week. So
I was going to ask you too, if your life's goals, even though you already have a career, I know you haven't gone back to work quite yet, but has it changed your perspective on life, what you'd like to do next? And
yeah, I think it would anyone, but for me, my work life before my daughter was born defined me. I felt like, I work here and this is the profession I'm in, and now I just live one day at a time and really try to enjoy my family, and it's been great being with my 4-year-old. We've had a great time, so just really trying to slow it down just a little bit.
And your message to other women who will see this interview and go, wow, that could maybe happen to me.
Oh yeah. Really listen to your body. I think it's so important to know that the signs for women's heart issues aren't always the chest pain. You know, you could have the shoulder pain or the neck pain or an arm pain, and don't ignore it. I know for women, mothers, working moms, you feel so busy and you don't have time to devote to yourself, but listen and take heed. Go to the emergency room. I mean, before this, I would have probably been so embarrassed if I went to the emergency room and maybe it was nothing, but I'll go every time now.
You've learned a lot about yourself, your body. All right.
Yeah.
Thank you.
Thank you.